So we started on this journey about 5 years ago in which we were trying to develop a business model for integration and collaboration with the physicians in the community. As Cone Health Medical Group continues to grow, obviously size will dictate some standardization with that growth. But one of the things that we're trying to honor and make sure that we incorporate is still the unique identity or brand for each of the practices.
Our vision was to bring our now 350 or so physicians, 450 providers into a high-performing medical group.
I'm Todd Early. I'm a vascular surgeon. I came to Greensboro in 1991 after my fellowship. I joined a large, established cardiac and vascular surgical group that really had a lot of clout in the community. It was very well respected, and we kind of saw ourselves as bedrock. With the changes in the medical economics over time, we really became to the point where we were difficult for us to keep the doors open and really went to Cone needing assistance in our practice. Since that time, it's been an extremely supportive, very good endeavor for both of us.
As LeBauer became part of Cone Health, and after we signed the contract, I think the biggest concern was whether we were going to be allowed clinically to run things. And that has actually been the strongest part of our relationship.
All of the forces changing healthcare have fairly rapidly turned healthcare from a individual sport into a team sport.
One of the things I'm looking forward to is the optimization of the electronic medical record that we are currently using.
The system has been real good about allowing us to make decisions that is beneficial for our practice, which is obviously beneficial for the community as a whole. For example, we've been able to expand offices. We've been able to make capital purchases. And these were concerns when we entered the group.
Would you rather not jump in, actively address change and create the change our community needs and have more control over the process?
One of the major advantages with working with Cone Health is that they have an entire staff whose job it is to figure out how to meet these objectives, how to document them in a way that is standardized.
Some of the reservations that we had initially coming on board with CHMG was one of timely reviewing our financials, and at times there were some inaccuracies, but they were able to sit with us and identify those errors and correct them so that we could move forward and not stumble on these mistakes again.
I'm very bullish about the future with the group. I truly believe as we enter this new era of healthcare, this is going to be a great, great thing for the community, for the physicians, and for the hospital as a whole.
We've had some challenges, but I think we're making progress. My success as an individual doctor is more and more every day dependent on how well our group does and how well Cone Health does.
A specific example of the culture experience within Cone Health Medical Group is the way that I've been embraced by the Executive Council as a physician assistant.
An example of how Cone Health Medical Group is now working is particularly relevant in my field for the cardiovascular service line. We're working currently on a large project to bring cardiovascular services together across the community in the outlying areas. And Cone Health Medical Group is the infrastructure that allows us to do that. The culture is one, again, of working together, coordinating care, and aligning goals.
This is the first endeavor that I've been part of in the 30 years that I've been in Greensboro that's actually kindled some enthusiasm in me as I see it operating.
The Cone Health Medical Group culture is positive because of the ability to collaborate with people that I've known all my life and worked with, but now we're trying to work together for the benefits of our patients.
One of the things that I've appreciated about the group is that their steadfastness about quality.
A key component of Cone Health Medical Group's plan and design for the future is to obtain data and turn it into information.
I've been particularly excited about the fact that, again, administration and physicians are sitting side by side. They're no longer in separate rooms, they're no longer having separate discussions, and it's exciting to be a part of that.
So vision for Cone Health Medical Group. I'm a pretty pragmatic person since I'm a surgeon, so I'm not really a visionary, but I really do feel that we have the startings of something that really can be special.
By being part of an integrated network of individual, unique physician practices who are bonded together through a common governance and share a common purpose and vision, we can truly achieve something special. So what can you do? Well, you can start by becoming engaged, attend meetings, join committees, and get to know your partners. Call us. We will call you back and we will have your voices heard. Your opinions will count in all that we do, and I'm sure you can join me when I say I am proud to be a member of Cone Health Medical Group, a distinctive partnership driving exceptional care.